Thank you, everyone, for joining us this afternoon for our discussion of a New Deal during COVID. We're going to explore an ambitious idea to create a huge health corps in the United States to deal with this pandemic and health crisis that we're in. This event is part of our series from the Ash Center for Democratic Governance and Innovation at the Harvard Kennedy School on democracy and justice in this pandemic. Today, we're talking with Gregg Gonsalves, Amy Kapczynski, and Alan Khazei about their bold ideas to create this massive jobs and public service program to rebuild not just our health, but our economy and society in the wake of the destruction of COVID-19. These ideas that we're going to talk about this afternoon are inspired by big public employment programs of the New Deal era, such as the Civilian Conservation Corps and the Works Progress Administration. Back in the day, those programs employed millions of Americans and created public goods that this country enjoyed for many decades. As I was talking to a friend about this event, he was saying, well, it's time for a program like that because a lot of the infrastructure that we created was because of that New Deal, and it's a little bit time for a refresh there. And I thought that was a good point. In their Boston Review article, Gregg and Amy argue that America should create a community health corps. They write that, quote, funded federally and organized locally, it would put millions of Americans to work caring for one another and with far more sweeping goals than just turning around the skyrocketing unemployment figures that we see today. Gregg is an assistant professor of epidemiology and an associate professor at Yale of law at Yale University. For more than 30 years before entering the academy, he worked on HIV/AIDS and other global health issues with organizations that include the AIDS Coalition to Unleash Power, the Treatment Action Group, Gay Men's Health Crisis, and the AIDS and Rights Alliance for South Africa. Amy is a professor of law at Yale Law School, faculty co-director of the Global Health Justice Partnership, and faculty co-director of the Collaboration for Research, Integrity, and Transparency. Prior to coming to Yale, she taught at the University of California at Berkeley and also served as a law clerk to Justices O'Connor, Breyer at the U.S. Supreme Court and to Judge Guido Calabresi of the U.S. Second Circuit Court of Appeals. Our third guest is Alan Khazei. Writing in the Boston Globe with his co-author, John Bridgeland, they called for, quote, the president and the Congress to enact a federal emergency service to nation jobs effort to immediately engage 500,000 young people, ages 18 to 26, 1 million of them by year 2022, in a year of national service to put them to work and to meet the nation's pressing needs. Alan, as many people know, is currently running for Congress in the 4th District of Massachusetts. More than anything else, Alan is a social innovator and entrepreneur. I'm very proud, happy to call him my friend. He's co-founded and ran City Year, ran Large AmeriCorps, which was a large AmeriCorps national service program engaging 17 to 20-year-olds in lots of cities in the US, UK, and South Africa. He also founded Be the Change, a national network of organizations devoted to national service, fighting poverty, and empowering veterans. And most recently, he created the Democracy Entrepreneurs Organization. So welcome, Gregg, Amy, and Alan. And for people watching on the YouTube stream, as we kind of go through this conversation, please feel free, please do type in any reactions, comments, and especially questions that you have, and we'll integrate them throughout this discussion. All right, so the first question is for all three, Gregg, Amy, and then Alan. The first question is, why do you think we need a large public jobs program right now? States already have health departments and hospitals to deal with COVID. And as states open up and the economy gets going, won't people get back to work? Isn't this pandemic kind of a problem that's on the downside and we're already seeing the issues work themselves out? That's the question. And maybe Gregg first, and then Amy, and then Alan. Oh, Gregg, I think you're muted there.
So if you look at the New York Times right now, it talks about how the virus is on the upswing in a whole host of states across the US. And in fact, I think what we're about to see is that we haven't conquered COVID-19 by a long shot, and that we are going to be living with this virus probably not for weeks and weeks, but for months and months, and perhaps for several years. Now, a couple of things. As Amy and I wrote in the Boston Review, the roots of the sort of spectacular collapse of the American response to COVID-19 had roots in our deep past. The way we structured our healthcare systems, the way we sort of torn apart our safety net over the past 40 years at least, and that we've seen a systematic sort of disintegration in our ability to respond to public health threats long before this virus ever hit our shores. If you look at life expectancy at different places around the US, among different demographic groups in the US, we may have the richest country in the world with the most technologically advanced healthcare, but we have life expectancies that are far worse than our European and other industrialized nation peers. And some of that is because public health investments have gone down over the years. We've seen 50,000 or more jobs in public health at local and state levels decrease over the past 10 years. For every dollar we spend on healthcare, we spend 2.3 cents on public health. So the reason we said we need the community health corps is because we have a lot of work to do, even absent COVID, to lift up American health to be where it is, to be anywhere near what our peers in Europe and other places in the industrialized world have. And also the fact that we have an epidemic on our hands right now just compounds the injuries that people are facing, and that just calling them up and saying, hi, you've come into contact with somebody with COVID-19, stay at home for 14 days and get tested, is not a public health response. People are going to have a whole range of issues for whether it be if they can put food on the table, or they're living with a domestic abuser and need to get shelter somewhere else rather than isolating where they are. There's a whole set of social and economic support that they're going to need and do this. And the point is, we want to pay people to do this work. Volunteerism is great, but there are many people suffering right now who need jobs in these very same communities. And that's why we want a paid community health corps in order to address some of the social ills we faced for centuries in the US, but are just exacerbated now in the context of COVID-19.
That's wonderful. Thank you very much. Amy, why don't you go? Why do you think we really need this health corps? And what are one or two of the biggest problems that you hope that this proposal would help to address?
So, building on what Gregg was saying, we know that we need more than contact tracing and testing to allow people to do what they need to do what we want them to do, to be able to protect ourselves and our communities from COVID, right? And so one big piece of it is we need to rebuild this infrastructure of care, building on models like community health workers and programs like medical legal partnerships that provide legal assistance to people who have health issues, to make it possible to deal with, to start making some inroads in the structural conditions that make it hard for people to do things like stay home from work for a couple weeks, or to social distance because who's going to care for their elderly relative, or who's going to go out and buy groceries for their kids, right? And so we cannot ask people to socially distance. And I think you're starting to see evidence coming in when you read about what's going on, when the small contact tracing programs we've built, how they're working is that it turns out that they reach people, but people aren't in a position to be able to do what we'd like them to do. We still need massive infrastructural support for people to be able to just do the bare minimum that we need to do to be able to kind of mitigate the effects of the virus. And by the way, I think those needs are going to increase over time. We're going to have, this is a moving target, right? We have people who are now coming home who have disabilities and may have long-term care needs, right? We need to start building that infrastructure. We hope we may have interventions like vaccines. And we also know that kids aren't getting vaccinated, right? All kinds of healthcare needs are falling off of the radar. We need people to address those kinds of needs. I think if you look around at the protests that have been also going on over the last couple of weeks, and the demand to turn away from carceral approaches to social problems and rebuild an infrastructure of care, that links up here too, right? One of the things that has been really thrust to the forefront and that is critical is that we can't be using police to solve social problems and as our kind of social workers, right? And whether you're talking about who's going to enforce mask rules, do you want the cops running around doing that kind of stuff, or do you want ambassadors who are social service workers, who are public workers, who are from the communities we're talking about to do that kind of work, right? Or, and how do you build in structures of care so that fewer things become the job of the carceral state, right? And you can see this as part of the attempt to shift to rebuild social infrastructure that helps address problems in a much more effective way. Those are problems that are driving COVID, but they're also driving a lot of other other kinds of violence and exclusion and kind of inequity in our society. The last thing that I'll say is I think we need a program like this because we need a model of government that people can kind of rebuild their trust in their local, state and national government, right? We've had a lot of failures in this epidemic. And the idea that we're going to reach out to people and say, stay home for 14 days, but nope, we can't provide you with hand sanitizer, nothing. We got nothing for you, right? That's not a workable model. We need a kind of compact where when we ask people to do difficult things, we provide support for them. And I also think, frankly, we need to explore jobs creation as a public policy matter and create a program that would explore how we can create jobs that are federally funded, but locally administered and make them effective, good jobs that we can then build upon, because this recession and kind of economic cataclysm is likely to be with us for quite a long time. And jobs programs should probably be part of that. Think about how the Green New Deal or other programs envision there being public jobs programs. We want a prototype for something like that as well.
Great. Thank you very much. And I want to come back to a couple of points that you made about the importance of social service workers in a minute. But first, I want to give Alan a shot at this question because your proposal is a little bit different. You're trying to address some of the same problems, but some different ones. So what are the big problems that you hope that the Boston Globe article proposal would address?
Sure. Thank you, Archon. And I completely agree with Gregg and Amy, who've made a really great case. So we are dealing with three unprecedented crises in our country right now. It's never been a period like this in history. We have the healthcare crisis from the coronavirus, which has now led to the economic crisis. And on top of that, we now have the race crisis because of the horrific killing of George Floyd and the extraordinary response of people peacefully protesting across this country and even across the world to say we have to do something about this. So what I've proposed is that we have a dramatic expansion of national service that really could deal with all three. I do think we could have 500,000 young people immediately, and then 1 million within a year. We did this during the Depression. We are entering a period like the Great Depression, where the crisis also leads to opportunity for big transformational policy change, like Gregg and Amy are recommending. Here's what it could do. And we've seen this with national service. We have millions of young people graduating from high school and college this month into the worst job market. The teen unemployment rate is 29%. Young adult unemployment at 18 to 24-year-olds is always 2 to 3 times that of older adults. So jobs are being canceled, even internships are being canceled. We need to put them to work. We need them to fight the coronavirus. John Hopkins says we need 300,000 contact tracers. We have about 10,000. We need a public health corps, as Gregg and Amy, and they can even do more. Daniel Allen, your esteemed colleague, who's also a friend of mine, says we need to test 5 million people a day to safely reopen the economy, which we've now started to do. And actually 21 states the virus is increasing, 21. It's moving. We have to have the testing and the contact tracing. This is something young people can do. Unfortunately, this virus is attacking more low-income people, more people of color. This generation is more diverse. They understand technology, and they can do much more public health work, like supporting our folks in nursing homes. We haven't even begun to understand the impact and how nursing home staff are overwhelmed, and young people could be trained to be support staff and all the other stuff. We need an education pool. I've got an 18-year-old and a 12-year-old. They've moved to online classes, but they're in school roughly maybe 2 hours a day instead of 6. And there are millions of low-income young people who don't have access to broadband or computers. They've been out of school for 6 months. We can have hundreds of, and again, AmeriCorps programs do this, City is doing this. We need a 21st century version of the CCC. The CCC was created in 3 months from scratch, and there were 300,000 people. It grew to 500,000 people. We have 25 years of experience with AmeriCorps. We have over 60 years experience with the Peace Corps. We have an infrastructure, and we need an opportunity corps. Finally, we have seen that when you unite young people in service from different backgrounds, we understand our diversity is our greatest strength. It is a way to help unite people and it's not the only thing, but start to deal with the systemic racism, which finally people are recognizing after 400 years. So 93% of AmeriCorps alumni say that they are more comfortable working with people from different backgrounds after their year of service. 80% of them say that they are confident that they can put together a plan to solve community problems and invite others from different backgrounds to join them. It's just two examples. So this works. It's also a strategy to deal with the race, huge challenge, which is now thankfully people are waking up to. So that's why I think it's so needed and it's necessary, and we can do it. We have the infrastructure to be scaled up.
Thank you very much, Alan. I want to return to some points that Amy especially, but then also Gregg made. If you think to just a year ago or during the Democratic debates, primary debates before the COVID pandemic, a lot of people thought about Medicare for all as the solution to many, many of our healthcare problems. And then COVID comes along, and all of a sudden, we have much more awareness and much more attention to public health rather than just healthcare. And the way that all three, Alan and Amy and Gregg are talking about what this healthcare core could do, seems like it would be protecting not just public health, but health and take over. Remember, Medicare for all is the idea that everybody would get health insurance, but the people who take care of your health would be professional providers and insurers and hospitals and doctors. And now all three of you are proposing that maybe, well, that would still be true, but part of the people that would be taking care of your health in this view are 500,000 or 1 million regular people that would be enlisted into the community health corps. Can you talk about those maybe different, somewhat different and complementary, but different visions of who takes care of health? Is it a private system in which everybody has insurance, and or the community health corps that you guys seems like you're thinking this can do a lot more work than contact tracing and testing and isolation? Anybody want to jump in on that?
I can jump in. So,
Yeah.
Public health is the invisible shield. We don't see it until you need it, right? Everybody's talking about public health now because public health's goal is to prevent outbreaks, to prevent you from getting severe complications from diabetes or needing to get a mastectomy because you didn't catch breast cancer early on. And so public health has always been a key part of our healthcare universe. But in the US, again, we downplay it and spend a lot of money on fancy technological fixes for healthcare and spend a lot on end-of-life care and all these specialty services rather than primary care and preventive care, which are part of public health. I think the idea about the community health corps and why we need to go deeper and broader into our communities to deal with health issues is because we have too many people coming in to hospitals and to clinics with preventable diseases and conditions which could have been managed in the community many years before they end up coming to a doctor for a complaint that's now gotten so bad that they're going to need sort of advanced medical care. And so this is not a new thing. Many other countries, and particularly in developing countries, rely on a much broader set of community health workers to get the job done. In Massachusetts, where you all are, Partners in Health is starting up your contact tracing program, but they have a broad range of people who they call accompagnateurs in Haiti and in Rwanda, who are providing a set of health services that are fundamental to keeping people healthy in that central plateau of Haiti or wherever Partners in Health is working, in addition to the sort of expert doctors that Partners in Health has trained in Rwanda and Haiti and elsewhere, and people are coming from Boston to give care. So healthcare, yes. Medicare for all, yes. But public health for all too. It's the missing link in the American healthcare experiment, and we need to sort of rectify that now before we get hit with another pandemic or the next wave of COVID-19.
Yeah, I would add, I think Gregg is absolutely right. Again, I would add, Arkan, your insight is right on, which is we've generally looked at healthcare as an individual issue. Like, do you have insurance or not? Do you have access or not? When the coronavirus is making clear so many of these issues are public health issues, and we need to move to a system where we are thinking about public health. And Gregg is right. You look at issues like obesity, diabetes, nutrition, that we need to move to more of a prevention system. And you could have, as part of a new public health corps, going into schools and educating kids. And there are service programs that are already doing this. Food Corps is doing this, for example, but it's tiny. We need to scale it up about what is healthy nutrition, what is healthy eating. Share Strength is doing this as well with their No Kid Hungry program. When we've been able to understand issues as public health issues, we then look at them a different way. drunk driving initially was seen as like an individual responsibility issue. Then Mothers Against Drug Driving branded it as a public health issue because so many people were being affected by drunk driving. Similarly with smoking. Initially, it was seen as an individual choice, and then we saw the secondhand effects of smoking. It became a public health issue. Gun violence has to become a public health issue. And so there are so many things that if we look at our healthcare system as not just individual access, but how is this a public health system, we will actually get to better health care for people. And you don't have to have, we need the doctors and the nurses, but there's a lot that people could do that could be trained to do on the public health side through a service corps or a public health corps that will actually dramatically improve our healthcare as a community, as a society, as a country.
Just add one thing to that, which is to say, I think we've talked about healthcare as being only one component of what you need to be healthy. We've talked about public health as filling in some of what healthcare doesn't do, particularly on the preventative side. But the other thing that needs to be part of the story is health equity and equity in general, because we know from a long literature about health equity that inequity is a fundamental determinant of health status and disease. And you've seen it with COVID, right? You've seen how communities of color have been disproportionately affected, how people who are in essential jobs that frankly are bad jobs, many of them, because there are no labor protections for those jobs, right? It's and decades of the kind of embodied reality of racism, which works its way in all kinds of ways, right? Into the health disparities that then COVID has really revealed and exacerbated. You know, though we need to think about solutions for inequity, and we need to be thinking about how the changes that we make, both to our healthcare system and to our public health system, can be changes that kind of build more democratic structures of power in our society, right? Because it's not all about either individual choice, healthcare, or a public health system, right? It is also about people having the authority, whether that's the authority at work to say, hey, I'm not going to work without a mask, or hey, you know, we need unemployment insurance that really works, like wage replacement rather than unemployment, right? Those are the structural pieces of a social response that can keep us healthy. Some of them fall into healthcare, some fall into public health, but you know, zoom out and you see that these issues are really fundamentally about equity and the sort of structure and nature of our democracy. And so as we are thinking about jobs programs like this, we need to be thinking, how do we rebuild those kinds of deeper infrastructures? So focus on questions of equity and power so that we don't end up just overlaying another sort of technological fix on what are deeper structural problems.
Yeah, that's a great point. And I hope we'll be able to get into that a little bit more. Just on the health core part, I guess one of the appealing things I see about it is it would be a kind of equity first health strategy, because, you know, I imagine the people working in the health core wouldn't come to Brookline, Massachusetts. That wouldn't be their first stop. I mean, they might be there, but that wouldn't be their first stop, right? I mean, it would begin with people who have less advantages and are subject to the hard side of these health inequities and public health inequities, as you
right.
say.
And Greg and I think it's really important that you hire people from the most affected communities, and also that these be good jobs, that they stick around, and that's part of turning away from volunteerism as a model, but then trying to think structurally about both, right, how to bring in folks from those communities because they have the knowledge you need, but it also helps with the structural piece of kind of rebuilding a kind of democratic America.
Good. And so that is a good segue into a second question that may go to some of the difference between Gregg and Amy's proposal and Alan's proposal. Alan, the program that you and John Bridgeland offer grows out of your own long experience in youth public service and discussions around national service programs like AmeriCorps and Peace Corps, which is probably a slightly different audience of potential workers in the health corps than Gregg and Amy suggest. So can you explain how your program would work? Who would be eligible? Is the college student, the recent graduate at BU who's looking to contribute, somebody else? What would they do? How long would they do it? How much would they get paid? What would it be like?
Sure. Well, thank you, Archon. So, many of us have been working to create a new rite of passage for young adults in this country that basically when you turn 18, we'd like to see a day where the most commonly asked question becomes not where you're going to college or where you're going to work, but where you're going to serve. because it's become just sort of a cultural expectation, not mandatory, but a cultural expectation. And we think that that will fundamentally change the country. And if you have the right incentive, the reward programs, people get paid and they also get a post-service award, which I think should be for the American dream. Right now it's an education award, but not everybody goes to college. So I think it should be expanded, much like the GI Bill was created after World War II, where you could use the funds to pay to college. And I think it should be the equivalent of 2 years of public university tuition for each year of service. But you could also use the funds for job training programs, apprenticeship programs, certification programs. You could use the funds for that first down payment on a home, which is the American dream. You could use the funds to be a small business or a nonprofit entrepreneur if you have an idea. And many people actually get ideas after your service. So it is compensated and it's a reward system. What we proposed would be, this new rite of passage would be for 18 to 24-year-olds or maybe 26-year-olds actually. So you could do this after high school. You could do it, take a year off from college. If you go to college, you could do it right after college, or you could even go to law school or medical school and decide to be a public health doctor or a legal aid lawyer, for example. And the way it would work is, so we have AmeriCorps now, and we have 25 years, so it'd be scaling up AmeriCorps, but there's also a new idea, which I have the privilege of serving on the National Commission on Military, National, and Public Service, which was one of the principal recommendations. AmeriCorps was designed 25 years ago. It's a good program, but the world's changed fundamentally. We have technology. The nonprofit sector is now the fastest growing sector. It's 11% of our economy. We have 1.4 million nonprofits. So the way it would work is this. Any young person who wants to do a year of service would be able to sign up for a lottery to get a fellowship. The fellowship would cover their stipend, their living stipend, and their post-service award, paid for by the federal government. And then they could serve at any nonprofit that gets certified as a national service organization. So they walk in and say, okay, I've got my fellowship. You just have to essentially hire me. And the organization has to commit to provide the training. They have to agree to the AmeriCorps rules, no political activities, no displacement of workers, no, has to be meaningful work. And state commissions would oversee that. Every state has them. And we could scale up dramatically because there are 1 million nonprofits that could be hosts. And then there would be community programs to make sure that people get to know each other and do common trainings and swearingings and all that. If we implemented that, we literally could have 250,000 people within a couple of months because it gives choice. You use technology, young people, this generation wants to have that. And it would also go to more local and community-based organizations that don't have the infrastructure to apply for federal funds. So that's what we're basically proposing. Grow AmeriCorps, but then add this new fellowship program, which would be across the country in every congressional district. So to make sure that everybody gets a chance to serve. If we implemented that, we could have 500,000 people within a few months. We could have 1 million certainly within a year, and we could have even more depending on the demand. And I think there's going to be huge demand. Now, last thing is we also need every generation to serve. AmeriCorps is open to, from 18 to 80. And we believe we need that. There's encore service and there's value of intergenerational service. But what we've been focusing on is this new rite of passage, because as I said, when people do this at that critical time, they continue to serve more, 90%. They continue to learn how to solve problems. They turn on what I like to call their justice nerves. When you spend a year of service intensively with other people from different backgrounds working on injustice, you learn power, you learn efficacy, you learn the value of making a difference, and then you continue to do that for your rest of your life. So that's what, and it could be in public health, education, opportunity, environment, as I said, but it's really about this new rite of passage for the country. We revere the generation of the Depression and World War II as the greatest generation because everybody served together, whether they were home or in the war. Every generation, I believe, will become a greatest generation if we institute this new national service at scale, 1 million people at least a year at that critical time. And then the country fundamentally changes.
Great. Thank you very much, Alan. So that was an incredible kind of description of the vision of this large service program as creating a whole generation of much more civically oriented, justice aware, small d democratic Americans, in addition to all of the health, public health work and other kinds of contribution that they would make right now, right in the next few months in the next year or two.
That's right. Something that you care about. So 94% of AmeriCorps alumni are registered to vote. 94%. So, I mean, you've been leading an effort on voting. Well, again, if you do this, you get turned on, you realize, why is it important to vote? Well, you spend a year working in a city community or on public health or on fighting poverty. And, oh, okay, so it does have that sort of civic engagement, supercharger.
That's fantastic. And Amy and Greg, your program is less inspired by, less expansion of current national service programs and visions and plans for national service, and inspired more directly, grows more directly out of New Deal ideas, which weren't necessarily targeted to young people, but really those suffering from job loss and economic depression. So can you do a similar kind of exercise? Explain how your program would work, who would be in it, what would they do, how much would they make, what would they do after the program if there is an after the program? What would the nuts and bolts look like if I wanted to participate?
So I'll start then. So Partisan Health is paying people about $27 per hour and giving them health insurance in Massachusetts. We think people should be paid a living wage, not a living allowance. And so these should be real jobs that people can sustain their families on, whether they're young people working or middle-aged or elderly people working. So we need to be able to sort of give people the support they need to sustain themselves, not just through COVID-19, but economically over the years ahead. And so we're talking about jobs that start with a wage that is reasonable to raise a family on or to support yourself on, that has benefits that many of us on this call take for granted. So we also think it's a platform for young people, for instance, to further education and job training, so that if they find an interest through the contact tracing program and going into skilled nursing or getting an RN, they could do that. And think of it as, if we're talking about sort of old school ideas like a GI Bill based on the work they've done as part of this community health force. The other thing is, and it's not a pushback to Alan a bit, is that there's something in our proposal that's about reviving the idea that government can do good things for you, right? And building up the idea that the state is an important actor in your lives, and that, unlike Margaret Thatcher said, there's no such thing as society. Well, there is, and we do things together, and we pay our taxes so we can uplift everybody, not just pay our tax breaks to corporations. And so there's been all my adult life, there's been this sort of volunteerism fantasy that Paul Ryan and others have sort of suggested, is that we don't need the federal government to do this work and support this work. Communities can take care of themselves, and we can do this on a volunteer basis, or we can do this sort of as a civic give back to the places we live. I think we have to embed this as part of our society moving forward as real jobs for real people over the long term. I agree with national service in a certain extent, but it doesn't replace the need to sort of build up the sort of economic infrastructure of communities that have suffered from underemployment and unemployment way before COVID hit. Amy?
So yeah, just to speak a little bit more to the kind of how would it work and what would people do. I think the key kind of pillars of a program like this are federally funded, but locally and state designed, so that the federal government would provide the resources for the jobs and some broad parameters about the kind of jobs that would be appropriate and would probably address other kinds of things. Maybe there would be some kind of oversight board, governance board that community organizations and labor, for example, could participate in something, so there's some broad parameters set federally, but a lot's then going to be determined locally. And the jobs, therefore, also could be quite diverse and tailored somewhat to what the local needs and capacities are. So what kinds of jobs are we talking about? Well, so we know there's contact tracing and jobs related to scaling up testing, but there's also a wide variety of, if you can think of us as home support for people who need to isolate, whether that's, grocery delivery or providing of sort of some basic connections to support around things like childcare or dog walking, or perhaps even some of that care itself. We would need to think about supporting the businesses and reopening, like places that are reopening, whether that's from nursing homes to business, right? That with protocols for infection control, things like that. There's those kinds of jobs. I think there are some home care, healthcare needs that really are going to scale up. And that might not necessarily directly be provided through a separate program, but there are existing programs like Medicaid that provide home care that might need some scaling up as part of this vision, right? So that you get, one of the problems that we're seeing now with COVID is that people don't get to the hospital in time. Now, that there's a piece of that that's very directly about the problems of our health insurance system, where I think people are deterred, we know, from going to the hospital because of fear about costs. But there's another part of that that's just about the need for people to be monitored at home. And that's a kind of skilled care that you would not be able to do without a little bit of background. And so I think another important piece of this is Gregg and I do envision this as leading to long-term jobs largely in the public sector, although certainly there's imagining some involvement from community-based organizations, the kind of nonprofits that Alan is talking about, because we really have seen in this crisis how weak our infrastructure is in public health, but also more broadly, if you think about the problems, scaling up unemployment insurance and things. So we need in the short term, both navigators to help people access those services. That would be another important job, right? Help you get your unemployment insurance, or help you deal with, if you're having an eviction crisis, which we're likely to see many people having, to help you get the supports you need, but then those become jobs that stick around. And those jobs become largely public jobs that basically can help rebuild some of the governmental infrastructure so that we have a big team of community health workers and kind of other related care jobs that can help actually provide the governmental support that we need to provide and rebuild our infrastructure to be able to provide that care.
Yes, Archon, if I could just build off.
Sure, yeah, please.
Gregg and Amy said. See, I think these things that we have come at this with different focuses and trying to address different challenges, but I think they, in some ways, really fold together nicely. I love what you guys are proposing. What we've seen is, if you have a year of service as a new rite of passage, and if it's at scale, if it's at least 1 million people a year, and if you have a public health corps and an education corps and a climate action corps and an opportunity corps, that then will turn people on to the kind of jobs and opportunities that Gregg and Amy want to have, which I agree with. So we have a nursing shortage in this country. Now, if people spend a year in service as part of a public health corps, and they're doing public health work, and they're being exposed to the issue of health, more of them will then decide to go into nursing or medicine or health as a career, or some of the jobs, which I agree should be living wage jobs, that Gregg and Amy. We've seen this. The vast majority of people who do AmeriCorps go into the social sector because they learn the efficacy and they turn on their justice nerves. We are now, the city focuses on education. Increasingly, our corps members are becoming teachers because they get exposed to what it's like to actually be a teacher, both the challenges and the rewards. And they're going into teaching, in inner city schools where they've served. So, and we've seen this with other, there are young people now who are in conservation corps that are joining the public park service. Or there's FEMA Corps, and they're joining FEMA doing disaster relief. So if we had 1 million people in service and they got exposed to these issues, that would then provide the folks who then would be able to go and do the kind of public health jobs, good paying jobs. And Amy's absolutely right about the equity issues. So in many ways, these two things go hand in hand, with a little different emphasis about the challenges we're taking on.
That's great. Thank you very much. So also one theme that people shouldn't miss that's common to Alan and Gregg and Amy, I think one of the things that all three of you are aiming to do is increase the value of caring for other people in our society, right? I mean, just like full stop. What other more valuable activity is there? And yet it's not economically remunerated very well. It's not in our society and culture elevated, but I think that's part of what you guys are trying to do at the cultural and values level, which is just really, really important and fantastic. I want to turn now a little bit to the feasibility and the politics of your programs. Like, one of the things that really got me excited in reading both of your proposals is just like how flat out ambitious they are. Like 1 million people, that's amazing. And devoted toward providing and these basic needs and boosting people up and increasing voice, and at the same time as care and welfare. But both of you, or all three of you, you don't see these really as pie in the sky. I don't think that's not how I read it. You think there's real possibility for getting the kind of political support that would generate the money and the will to get this done. Can you say a little bit about where you see the broader support coming from in this COVID age? Maybe first Gregg and Amy for yours, and then Alan for yours. Like, who are your friends and allies in making some version of this real?
So Amy and I have had conversations with different congressional offices, almost exclusively on the Democratic side. And I can be honest with you, I don't think Mitch McConnell or Donald Trump are going to like this and are going to be interested in this at all. And a lot of it depends on our political futures. But as an epidemiologist, my greatest fear is that if we don't do this, we are going to really be unable to contain our epidemic in the United States. This is pie in the sky for 2019. For 2020, it's about survival. Because if we don't do this testing, contact tracing, and isolation in the context that Amy's talking about, in this much broader social economic context that Amy's talking about, we're not going to put coronavirus behind us. And so I think there are plenty of people around the country in political offices, from local to state to federal offices, who understand that this is not business as usual. I think even the Biden campaign is starting to entertain sort of bolder visions for structural reform than he might have talked about in a debate if it was happening in this summer, absent COVID-19. So I think that the epidemiological context is going to make it vital for us to do it. I think it's going to depend on the political fortunes of our country over the next few months about whether it'll become something real or something that we will look back on as a missed opportunity.
So I think that's right, and that a lot depends on the next election. That said, none of us quite know what the future holds with respect to just how the virus is going to rebound. And looking back, the fact that we had this stimulus package that we did, I think is an indication of how quickly politics can change when the situation on the ground changes, when there is real fear that, hospitals around the country, the hospitals in rural areas, and the kind of needs in local communities, if they become vastly greater, I think the politics of this shifts. Even before the election, I think, this may all happen around the same time. And so I think I would just sort of remind us to harken back to the fact that we did pass a bipartisan, very big package, which of course didn't go far enough, but I think could be a vehicle for ideas of this sort. The HEROES Act is out there, and I think there's going to be a lot of need for also state and local funding that's complementary to this, is hugely important. All of those kinds of pressures are going to continue, and a program like this could be added into the conversation about the need to fund. We're losing so many jobs right now. We're about to lose many, many more as states and cities deal with this catastrophe. And so there are going to need to be continued stimulus packages for years, I think, to come. And these kinds of things have to be part of that conversation, because what does it mean to say, it's a fantasy to say we're just going to reopen and businesses are going to get back to usual without building people's confidence that we're doing what we need to do to make those spaces safe for people, and without actually delivering that vision, right? Making work a safe place for people to go, making restaurants and shops a safe place for people to go and enjoy themselves, right? We have to kind of rebuild to make this idea that I think people, who don't generally like these kinds of governmental programs, what they want is the economic rebound and people to go back to normal. That's not going to happen. I just don't think that's going to happen. And I think this is going to have to be part of the solution. And whether or not and when that will break through and there'll be opportunities is I think, going to be determined by both the election and the vagaries of how the next year unfolds with respect to coronavirus.
Yeah, thank you very much, Amy. I'm of the mind that it's been a crazy year, but it's not necessarily going to get any less crazy. We had the biggest pandemic since 1918, and then a huge civil crisis and a reckoning with racial justice. And as you say, maybe there's large economic pain, even more down the road, and then November's coming. So all that, some more crazy, fasten your seatbelt. So Alan, I get the sense that you see maybe more bipartisan political support and political will for your proposal. So who do you see your allies and supporters as?
Thank you. And again, I think Gregg and Amy are absolutely right. We are entering a New Deal period. There's no question. And during the New Deal, things got done. Big transformational, bold ideas like Social Security, like the Works Progress Administration, like the CCC, which was created from scratch in 3 months, 300,000 people, like labor organizing rights. And in crisis, you can do big transformational things. And the fact is, there is support for this. So after we wrote this op-ed, John Bridges and I, and Bridget and I did it together because this is very bipartisan, the roots of national service. George H.W. Bush created the first Office of National Service. There's been bipartisan support on this going back to the very beginning. He did the first bill with Senator Kennedy. John McCain and Barack Obama came together for a major expansion of national service in 2008. An independent poll was done after our proposal. 84% of the people in the country support the federal government spending the money to immediately put 500,000 young people to work fighting the coronavirus in education, healthcare, et cetera, as I laid out. 84%. 89% of Democrats, 83% of independents, and 78% of Republicans. And the question was, should the federal government spend the money to put 500,000 young people to work? So that was an independent poll. Secondly, there is a bill right now in the Senate, led by Senator Coons and Wicker, bipartisan, to get AmeriCorps to 250,000. I think it should be 500 and then 1 million, but that's pretty big. And I think 5 Republican senators have signed on to that bill. So, and I think what's happening is kids are now graduating from college and high school. There are no jobs for them. And even Republicans are hearing from their constituents because youth unemployment is 3 times that of older adults. And so that's also building the political will for people on both sides to say, what are we doing for our young people? $3.7 trillion. And yes, bipartisan, not a dime for young people, not 10 cents. Nothing has been focused on young people. And now they're so I think that's also going to be a spur. And again, we have history of bipartisan support for national service going back to the very beginning. So, and it is going to be worse. This is not going to be a V-shaped recovery until we have a vaccine. It's going to be uneven. And I think as we go on, and as there are no jobs for young people, because the studies show this, during great recessions, they're the last hired. And if they don't get jobs during recessions, they are behind the rest of their lives. There's even higher mortality rates because people get depressed, they take lower jobs. And so I think the pressure will build. And then on top of that, you add this race in terms of concrete ideas, bringing people together for a year of service from different backgrounds on the common ground of serving our communities is a way to help build a coalition that understands we got to deal with racism. So I think you put all those things together, I honestly believe this can get done. We're probably going to hopefully we'll get something now. Certainly, I think by January, there will be the political will to do this and do it in a big, bold way.
Wow, thank you. So there was an interesting opinion piece in the Financial Times this morning by Professor William and Mary, and he was arguing that it's going to be a K-shaped recovery, that that part of the people who are well off, the professionals, et cetera, they're going to be on the upside. But then the people who in communities of color, working class people who have not been able to socially distance, who have suffered the brunt of both the health impact of the pandemic and the economic dislocation, that's going to be a little bit different trajectory. And one of the things that I love about your proposals is it's trying to create a future in which it's not a K-shaped recovery. And so more power to you on that. We have a couple of questions I'm going to lump together. I think the first round is for Alan here. Alexander asks, what is the best way for a young person graduating from college now without employment and states slowly reopening to get involved in service? Is it AmeriCorps, a local nonprofit, or the military? And then just let me add on to that for Alan, a 2-parter. David asks, why not make national service mandatory and then fold in a military option at the same time? Would you be for that, for getting to much more than 1 million if you made it mandatory?
Well, so I think, so to answer them both very quickly. So I think, yes, for a young person, you should look at AmeriCorps. Hopefully it's going to grow. There is a proposal right now in the Senate. We got to build support for it. I'd also say to you, young people need to advocate for this. Get on the phones, call your congresspeople, call your senators. Please, I want to serve. Serving in a nonprofit is also great. Unfortunately, nonprofits are struggling also, with the pandemic and not getting support. And the military is always a good option for people who want to do that. So I would push. You can look at the serviceyear.org website. You can look at the Corporation for National Service website. There are great programs that you can apply to. In terms of mandatory, so there's two issues with that. One, I believe that I don't think we need it. I think it's much better for people to choose to serve than to be forced to serve. And again, but that's also been polled. And in particular, it's always the older people who are telling young people, you have to do this. And if you poll it, young people don't want to be forced to serve. And you know what? Your friend John Della Volpe and mine has done the polling to show that you don't need to force them. As long as you have a good incentive structure, like what I've proposed, which is you get a living stipend. It's not like poverty level. It's enough to live on. And then you get this American dream, a post-service award that's significant. For me, it would be $22,000 for each year of service. I think that's enough of an incentive. Secondly, if we wanted to go from where we are now, which is 75,000 people, to 4 million, immediately, we couldn't do it. I think we could get to 1 million pretty quickly with this new fellowship idea and having nonprofits. But then the risk is we do that, and then it doesn't work, and then people say that was a bad idea. I think if we institute what I've recommended, which is get to 1 million people, have this new fellowship program, which can scale much faster, and we do that for a few years, we may then decide as a country, you know what? We now have the infrastructure in place. This has become a cultural expectation. Let's go to the next level. This happened with high school, by the way. Public high school, it took about a generation, 20 years, when we went voluntary, and then it became mandatory in the country. And I think we need to get to scale first, and then we can have a thoughtful debate. But I don't think we need to do it if we have the right incentives.
Great, thank you. So the second round, I think, is for Gregg and Amy, and it goes to how many people you'd actually need to do the work. And then I want to tack onto that, what are the most important 2 or 3 tasks that the Health Corps would do first and foremost? So Philip asks, how many contact tracers would actually be needed? So if you were focusing on partners, test, trace, isolate, et cetera, how many people do you suppose that would actually take? And maybe it's a lot less than 1 million. And then James asks, what would a health corps be able to establish broadband communication networks to provide online medical care and information? That is, and that goes to, what do you think the important work that the Health Corps would have to do beyond test, trace, and isolate? And we've talked about some things. I just wanted to get your sense of what the priority tasks are for America and for public health at this point. So how many people would it take? And then what would be the most important things that they do in your view?
I'll start off, and then Gregg, you can add things. I mean, so, I think this has been mentioned before, but, I think the estimates that we have at the moment, and this could be a moving target, in 6 months might be different, but, that we need 300,000 contact tracers. So I think that's clearly a big category. The other, I think, major categories are the kind of community health workers who end up providing the kind of caseworker support to people. And also, I think what we might think of as, I'm not sure exactly how to categorize this job, but, people who are going to be supporting the kind of businesses and other institutions to kind of reopening and kind of getting the infrastructural support that they need. That seems another quite a big category. I also think that we probably, as this goes on, need to think about this not just through the lens of the first wave of COVID, but in public health, we often talk about people who are infected by a disease and people who are affected by a disease. And I think in the same way, we need to think expansively about there's COVID and its immediate impact, and then there's the longer term impacts. So for example, we're losing thousands of educators in this country, and kids have been online in very kind of suboptimal learning situations. And so should a COVID specific Job Corps actually include teaching support? Maybe it should over time, right? Because in fact, that's part of what we need to respond to the pandemic, right? So I think you could think about adding new components as we learn about what the impact of COVID has been. And I think that will be quite an important part of it. And broadband might be a piece of that, right? If we do need people to be able to kind of isolate at home, but be monitored, and there is no current infrastructure that would enable that easily to happen, then yeah, that could be an important component of it. And I think you could start to see how some of our we could sort of experiment with how to fix some of our longer term infrastructural problems, like the lack of municipal broadband over time with a program like this. And sort of build out sequentially different kinds of jobs to respond to what we need.
Gregg.
So I think, there's no magic number around how many contact tracers we need. And I think Amy's figure 300,000 is, based on the Gillibrand-Bennett bill. And I think there's lots of numbers floating around, like 30 for 100,000 population and things like that. I think, what I'd like to get away from is this idea that it's just about the test, treat, and isolate. And I think Amy has explained this sort of wonderfully about how all the sort of components of people's lives we're going to have to integrate if we're really talking about lifting up people from the bottom up. I want to go back to this question about giving people good jobs. I'm very impressed by Partners in Health saying, we're going to pay the same amount as census takers, whether you're 21 years old coming out of college or you're a 45-year-old unemployed man. You're going to get $30 an hour and health insurance. And really think it's important to sort of build up people's economic security at this moment. We are all so many people are struggling at this moment that we're going to need to make sure that these are good jobs, provide additional training if you need it. There'll be some things we can do sort of straight out of the box. And I think maybe calling up people on the telephone and asking them if their contacts might be something that's lower skilled. Things like food delivery, medicine delivery might be something that as well. But as we start to move into sort of more critical tasks, like being an advocate for somebody who is dealing with eviction or utility cutoffs, may need some paralegal training or some support by sort of somebody with some sort of legal skills. And so I think it's a complicated set of tasks that should be reimbursed in accordance with their social need. And I think we have a high social need for it now. And so I'm very eager to make sure that this is a job corps and a training corps and offers people a lifeline that lasts far after COVID is all over.
That's wonderful. Thank you very much. So maybe we could just go around very quickly for final comments. And, you can comment on any aspect of this rich discussion already. One thing I would like to hear is kind of rising to the 40,000 foot level. Each of your proposals has a lot of brass tacks to it, and you want to get stuff done in the next year, but you're also aiming for more fundamental change. So maybe if you could, in wrap, say a little bit about the fundamental change that you're aiming for. And, one of the things that I really like at that fundamental, maybe subtle level, this isn't a huge, but I think it would be significant, is that your proposals would expose Americans to much more diverse experiences in other communities that they don't interact in now, which I think is really important as America has gotten much more economically and geographically kind of segregated and polarized. To have those different experiences, I think, would serve people well in all kinds of ways in the long haul. But that's just a little layer. But what are the more fundamental kind of values level changes that you hope this proposal would move the dime on a little bit? Maybe Alan, and then Gregg, and then Amy.
Sure. I really appreciate that question, Archon. We are in this unprecedented time. And I think that, there's going to be a pre-COVID and pre-George Floyd horrific killing America, and then a post-COVID and a post-George Floyd horrific killing America. And we have to decide what that America is going to be. This virus and this brutal killing have exposed the deep injustices in our country, as Gregg and Amy were talking about. Who has healthcare and who doesn't? Who has access to broadband and who doesn't? who is $500 away from a calamity and who isn't, as we're seeing now, miles for people getting into just getting food from food banks. We're also seeing the extraordinary spirit of the American people in these peaceful protests and people reaching out to neighbors. I think that what we have to commit ourselves now, and over 120,000 people have already died, I believe unnecessarily, because we've had a miserable response by our federal government. And 42 million people out of work, again, unnecessarily. We could have kept people in their jobs the way Europe has done, by paying them directly to stay in their jobs. I think as a legacy from this crisis, we have to commit to being a more fair, a more equitable, a more inclusive and race-conscious society. As we can't let George Floyd and Ahmaud Arbery and Breonna Taylor and so many others die in vain. We can't let the 120,000 people, and it's sadly going to be more, die in vain from the coronavirus without understanding that we need to commit to being a different kind of America that's more loving, more caring, fundamentally more just. And I believe the energy is there. We're seeing it now with these extraordinary protests, people risking even with the virus. And this multiracial coalition led by young people. It's always young people, by the way, who are on the front lines. And you talk about the political will. Well, if enough people stay on this, we can emerge with a very different country and emerge stronger and learn the lessons of this virus, which at the end of the day, it is about values. It's about who we are and what kind of country we want to be. So I think that's the challenge for all of us. And I believe that the will's there if we can tap it, marshal it, and if we have big, bold ideas that people can rally around so that there literally is big, fundamental policy change.
Thank you. Gregg. I think you're still there.
I think Amy might have mentioned this, but part of our proposal is about building power in communities. And what is the Black Lives Matter protests over the past few weeks have been inspiring for many reasons, but one reason is that they've been able to start to secure change around police use of violence, police use of force, and other reforms that were basically off the table up until 2 or 3 weeks ago. And we have to think of what we're doing now around COVID-19 is to build power in communities, because it's not charity, it's not a handout from the government. It's about building accountability for our leaders and what they do for us at the very, very local level, which matters most. And as Alan said, we're in this mess because of our politicians. And the only way we're going to get out of it is through sort of social mobilization, building power in communities. And I hope our project is not just seen as sort of a public health task, but one of social mobilization and reforms to governance. Amy?
Very much agree with that. And I think those are the lessons of COVID and also the Black Lives Matter protests, right? That we really have a fundamental failure in our democracy, and that to rebuild and to address that, what we really need are sort of forms of organizing, power building that can make our political leaders accountable for the kind of really deep systematic change that we need. I think the other piece that I might just add to that is that, Gregg and I have kind of talked about the need to rebuild the politics of care, right? And that means that we rebuild both some of the infrastructure and some of the political vision that begins to see and formulate responses to social problems that are about extending care and putting people in a position to take care of themselves and one another, and not policing and neglect and some, kind of the kind of forms of responses that have really dominated over the last many years. And as Gregg says, go back a very, very long way in this country. So that's, I think, the other component of it is this is actually just a first step, and actually quite a small step, but we hope could be both help on the power building front and emblematic of, and then built upon to build, say, a government that's more capable of caring for us and allowing us to care for each other, and that would help create an on-ramp to things like the Green New Deal jobs programs, things that could really begin to tackle the conversations that like things like climate change that we haven't even talked about recently because of the scale of these other crises. Yeah,
thank you very much. And on that note, one interesting thing about these proposals, in light of the post George Floyd killing, the Black Lives Matters protests, is that defunding the police and a whole debate about the appropriate size of policing has emerged out of these debates loomed large in the public stage. Nobody was talking about shrinking police departments 2 years ago, or even or a few people were. It's not true. Black Lives Matter was, but it wasn't looming large in the public debate. And now we're all talking about it. And so now we're seeing graphs of how much public money goes to the police versus all of these other fire and schools and human services, right? And the defund the police, shrink the police is about where you shouldn't spend public resources and where our social priorities shouldn't be. But your three proposals are a very strong assertion about where our social effort, public money, and our human effort should be. And that is in caring for one another. And you've offered a great idea and a set of ambitious proposals, which is exactly what we need right now for how to get from here to there. And I think everybody in the audience, and certainly I'm really grateful for you guys for doing that. If you're in the audience, please check out the written proposals. Gregg and Amy's proposal is in the Boston Review, and Alan's is in the Boston Globe, and we'll link to those in the show notes. We'll continue throughout the summer in exploring ideas about how to deepen democracy and increase justice during the pandemic and beyond. And a huge thanks to Gregg and Amy and Alan for taking some time out of their day to have this conversation. Thank you very much.
Thank you, Archon. Gregg and Amy, great to be with you. Thank you.
Thanks, everybody.
Thanks, everybody.
Great. Thank you, guys.